8:13 on this Thursday morning. Leave that up a little bit. Tim, Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Still waters run deep. I could see you being an AC/DC fan, are you?
I do like it, yes.
Bring it up, Tim. That was it. That's all we had, Doc. We got, as I understand, if we play more than 30 seconds, we have to pay for it. So there you go. I hope you enjoyed it. March is National Kidney Month, a time to raise awareness about the importance of kidney health. Dr. Brent Wallis, Chief Medical Officer of People's Health, joins us to discuss chronic kidney disease and tips for, pardon me, I'm sorry, tips for keeping your kidneys healthy. And Doc, I see people in these kidney centers, and boy, this is something you want to avoid at all costs. What do the kidneys do?
Yeah, sure. First let's talk anatomy. What are they? Where are they? So most people, almost everyone, has two kidneys, and they're about the size of a fist. And a lot of people don't realize, but they're actually in your lower back. They're on either side of the spine, just below your rib cage. And even though they're so small, they really perform a lot of complex and really vital functions to keep you going, to keep you alive. And, some of those include controlling how much red blood cells are produced in your body. They also help to regulate your blood pressure through producing certain types of hormones. And then what they're most known for is really acting as the body's natural filtration system.
You taught me something already. I thought they were the size of your lungs, but not the case, size of your fist. How do kidneys act as a filtration system?
Yeah, so they filter about 200 quarts or about 50 gallons of liquid every 24 hours. And so what happens is the blood actually leaves the heart and enters the kidneys through the arteries, and it passes through millions of these tiny filters in the kidneys, which are called nephrons. And those nephrons are like little waste baskets. They basically filter out all the waste, the toxin, and any excess fluid that you have in your body. And then that liquid actually passes into the ureter, and then it gets stored in the bladder as urine. So the newly cleaned blood then passes out of the nephron back into the bloodstream and goes to the rest of your body, but it's all clean by that point.
What are some common kidney concerns?
Well, anytime you have unhealthy or damaged kidneys, they're not going to function the way that they should, and that can lead to a whole bunch of problems. One that we hear about a lot, that we see a lot, is actually kidney stones. So if you don't have enough fluid pushing into your kidneys, the kidneys have trouble with filtering. They really can't make enough urine, and that excess waste can build up. It can bind together inside the kidneys. And if that happens, it can actually create a stone. The stone then can be too big to pass through the ureter into the bladder, and that can cause some blockage, which then creates a whole host of problems. And kidney stones, we think stone, they're not huge. They can be as small as a grain of sand or as big as a golf ball, so they can get very large as well. And then the other biggest concern we see is really chronic kidney disease, or what we call CKD. And chronic kidney disease is where you get a gradual loss of your kidney function, that filtration function over time. And when the kidneys stop working correctly, really they can't filter blood efficiently. And you can imagine what happens. The fluid in your body, and especially the waste and all those toxins, can build up. And that buildup is really dangerous to your body, to all of the other organs in your body, because it can really lead to a lot of problems like heart disease, nerve damage, and ultimately kidney failure.
Tell us a little bit more, if you can, about this CKD, chronic kidney disease.
Yeah, so chronic kidney disease is relatively common. In fact, about 1 in 7 Americans have CKD. And it's actually a progressive disease. So what that means is that it gets worse over time the longer that you have it. So what's really critical is detecting it early. If you detect it early and you actually start treatment, you can actually prevent CKD from progressing and then leading to all of those serious health complications.
What causes it?
Yeah, so it really, CKD is really when there's another health condition that's harming the kidneys over time. An example would be high blood pressure or high blood sugar levels like you get with diabetes. That can actually damage the blood vessels that are running through the kidneys, and that can reduce their blood supply or their ability to filter everything. The high blood pressure and diabetes can also directly damage those filtration units, the nephrons, That actually makes it harder for them to do the filtering and removing the waste from your blood. In fact, high blood pressure and diabetes are responsible for about 2/3 of the cases of chronic kidney disease. And we do see some other less common causes, things like autoimmune diseases, like lupus in particular. And then occasionally you can have tumors, or those kidney stones can lead to CKD as well.
When you say blood pressure, you're talking about untreated blood pressure?
Yeah,
Okay.
definitely. Untreated blood pressure. That's one of the reasons why it's so important to make sure you're taking your medicines if you have high blood pressure.
So besides those conditions, what else can put somebody at risk for chronic kidney disease?
Well, really, anyone can develop chronic kidney disease, and at any age. But there are, a few groups that we see CKD more commonly in. It has a very strong family prevalence. So if you've got a family history, so a relative like a parent, a grandparent, or a brother or sister who's had CKD, you're much more likely to develop it. And then the other major factor is aging. So, as we get older, your kidneys filter less efficiently. So after age 60 in particular, the prevalence of the condition begins to increase. And then most cases are within patients that are age 70 and older. And what happens is just really over time, the kidney function declines. It's a normal part of aging. But if that accelerates at all, that can result in chronic kidney disease. And then the other problem is people that are older tend to have a higher incidence of hypertension or high blood pressure or diabetes, and so that's going to lead to kidney damage as well.
Well, let's take a quick break. We're talking about chronic kidney disease. It is National Kidney Month. Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health. We come back, we'll talk about some of the symptoms of CKD, chronic kidney disease, and how do you diagnose it, and then how do we keep our kidneys healthy? 8:20, time for traffic now, WWL. 8:25, Tommy Tucker, WWL, talking to our friend Dr. Brent Wallis, Chief Medical Officer of People's Health. We call him Dr. B. And we're talking about kidney health. It's National Kidney Month, and we are stopped earlier when we were talking about chronic kidney disease. Doc, what are the symptoms of CKD?
Yeah, one of the bad things about chronic kidney disease is that it often has no symptoms at all, especially in the early stages. And so that's why so many people could have the disease, but they really don't know it. When it begins to progress is where you tend to see some of the symptoms. And it's kind of a whole host of things because it controls your whole body. Dry, itchy skin can be common. Some people can develop a lot of nausea or even vomiting. You definitely want to watch for any changes in your urination, and that could be either going to the bathroom more frequently or less frequently. And in particular, sometimes when you urinate, if you see bubbles in the toilet, that's something you want to let your doctor know about. That can be a sign of protein in your urine. And then because of the fluid buildup, because you can't filter the fluid out, sometimes you'll develop shortness of breath. And people will actually get swelling in their legs, sometimes even all the way up to their hands and their face. So if you have any of those symptoms, you want to talk to your doctor. They can really kind of assess you, try to decide maybe this is related to CKD, and we may order some tests to really check your kidney health.
How do they diagnose CKD?
So that part is really simple. There's some really simple tests we can do to look at your kidney function. One of the most common ones we do at most of the visits that you come in for is going to be a standard blood test. It's called a comprehensive metabolic panel. And what it does is it checks the levels of creatinine in your blood. Creatinine is a waste product that the kidneys should be filtering out. So if we start seeing rising levels of this creatinine in your blood, that could be a sign that your kidneys are not functioning well. Sometimes we'll actually do a urine test as well because that may give some clues to what the cause of the CKD is. And it's important to remember, unfortunately, CKD is not really reversible. It's progressive. But once it is detected, we can treat it, usually with medications and lifestyle changes, to really slow down that progression of disease that ultimately could result in something like dialysis.
That scares the heck out of me, Doc, and I certainly don't want to have anything like that. How do you keep your kidneys healthy?
Yeah, I mean, there's a few things you can do. Most people aren't thinking about their kidneys day to day, but it's really important that they do what they need to do to keep you healthy and keep everything in your body running. And so one of the most important things, especially here in South Louisiana, is stay hydrated, especially during the summertime or if you're outside and you're working. You want to make sure that you're keeping your kidneys filtering well. You've got to have enough water in your body. Bring a reusable water bottle with you wherever you go. If you're not a water drinker, add fruit or some sort of flavoring to your water because that hydration is really, really critical. And then eating a balanced diet, we can't say it enough, but it's very important. Fruits and vegetables, whole grains, any sort of antioxidants, those are going to be actually better for your body, but they're also going to be better for your kidneys as well. And then I think we say it every time we talk, but, there's a lot of things we do to our bodies that are harmful, and they affect the kidneys as well. Smoking tobacco and drinking alcohol really can cause a lot of problems. In particular, they can raise your blood pressure. That high blood pressure is going to put pressure on the kidneys and possibly cause problems. Alcohol in particular can cause a lot of issues with your blood pressure. So you really want to limit the amount of alcohol you consume and absolutely talk to your doctor about stopping smoking. And then, the last one I'll say, which is absolutely critical, is manage your high blood pressure and your diabetes. If you do have one or both of those conditions, those are really responsible for most causes of chronic kidney disease. So you want to make sure your blood pressure and your blood sugar are checked often, that you're going to see your doctor. And if you're on medications, make sure you're taking those medications consistently.
Once you start dialysis, generally speaking, are you on it for the rest of your life?
Yeah. Typically, the only way you can get off dialysis is to have a kidney transplant. So the end point of this is really severe. So do what you can to prevent the problems up front.
I don't know why, Doc. I've never had kidney problems, but those dialysis centers scare the living bejeebers out of me. So everything you said, I'm going to take heed of. Thank you, sir. Have a good week.
Thanks, Tommy. You too.
Yeah, you want to find out more about People's Health, you can go to peopleshealth.com. You can visit People's Health Medicare Center at 3017 Vets in Metairie. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765. And, of course, you can follow People's Health on Facebook, Twitter, and Instagram. And I would suggest you download the Odyssey app and use the rewind feature to listen to this again, what Dr. B had to say about kidney disease, because you don't want to go down that dialysis road. Time for WWL First News.